Now, in case of eczema, when you see eczema, this is a cutaneous response to the exogenous and endogenous factors. Eczema है क्या? Eczema is nothing but it is a response of the skin to some of the external factors and also some of the internal factors. ठीक है, इंटरनली कुछ जो इचिंग प्रोड्यूस करने वाला हाइपर सेंसिटिविटी रिएक्शन हो सकता है, उसके लिए बॉडी का रेस्पॉन्स है, या तो एक्सटर्नली कुछ केमिकल्स के लिए, कुछ डस्ट के लिए आपने एक्सपोज हो गया, उसके लिए रेस्पॉन्स है. ओके, व्हाट इज वेरी इंपॉर्टेंट इन एक्जिमा इज प्लूराइटिस इज डोमिनेंट सिम्टम. यहाँ पे हमेशा इचिंग रहेगा, इचिंग इज ऑलवेज डोमिनेंट. ओके, नाउ most of the time all the type of acute eczema, now eczema can be two types, one is acute, another one is chronic. एक्यूट एक्जिमा तुरंत आपको जो है कोई डस्ट के लिए एक्सपोज हो गए, केमिकल्स के लिए एक्सपोज हो गए, आपने एलर्जी के लिए एक्सपोज हो गए, तो तुरंत जो है बॉडी स्किन जो है आपको इचिंग के रूप में उसका रेस्पॉन्स देगा. इट ट्राई टू चेक दैट मटेरियल गेटिंग एंटरिंग स्टॉपिंग एंटरिंग इनसाइड द बॉडी. सो देयर विल बी एरिथेमा, there will be intense itching, and there is also oozing, weeping lesion. Weeping मतलब उससे पानी आ रहा है, that means स्रावा आ रहा है वहाँ पे, स्रावा, और oozing आ रहा है. ठीक है, this is commonly seen in case of acute eczemas, whereas in case of chronic eczemas when you talk, so generally chronic eczema में आप itching करके 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 क्या होता है कि स्किन जो है वहाँ पे लोकल एरिया इट इज हाइपर केराटिनाइज हो जाता है, और ठीक है थिक हो जाता है, स्किन बिकम थिकन एंड स्किन बिकम ड्राई and also scaly with the altered skin pigmentation, So this is how you have to differentiate acute eczemas and chronic eczemas. Acute eczemas are mostly they are srava yukta, and dry eczemas are mostly, or chronic eczemas are mostly ruksha parusha. रुक्षत्व और परुषत्व वहां पे ज्यादा है. Okay, now in pediatric practice we find three types of eczemas. Okay, number one is atopic dermatitis, another one is contact dermatitis, and another one is seborrheic dermatitis. All the three are basically nothing but eczema. ठीक है, एक्जिमा का ये तीन टाइप है बच्चों में जो मिलता है. एक एटोपिक डर्मेटाइटिस है, कॉन्टैक्ट डर्मेटाइटिस है, और सेबोरिक डर्मेटाइटिस है. जगह अलग अलग है, कॉज अलग अलग है. नाउ व्हाट डू मीन बाय एटोपिक डर्मेटाइटिस? Atopic dermatitis, contact dermatitis, and also the seborrheic dermatitis. This can be compared with the Charmadala, which is explained by Kashyapa. Okay, very simple. For whole Charmadala chapter, which is explained by Kashyapa, it is compared with the same. And we have got Vataja Charmadala, Pittaja Charmadala, Kaphaja Charmadala. Okay, so where there is itching is more and dry lesions are more, that is Vataja Charmadala. Okay, where there is itching is more, Srava is more, that condition is called as Kaphaja Charmadala. Okay, where there is a mixture and also some redness is more, okay, redness, srava, daha, etc. is there, so that condition is called as pittaja charmadala. Anyway, we will see what you mean by atopic dermatitis. Now this is a picture of atopic dermatitis in children. If you see, okay, see atopic dermatitis here, the scaly lesions are there, okay, scratching will be there, okay, then a spreading lesion will be there. Gradually it is increasing, face area is more affected. We will see what it is. Atopic dermatitis can begin in the infancy with the red VP patches, that means oozing patches, on the cheeks especially, which extend to the neck area, wrist area, hands, and also the extensor aspects of the limb. एक जगह से शुरू होगा, then it gradually go on spreading. Such infant will have the family history of atopic dermatitis usually. Okay, कोई ना कोई फैमिली मेंबर दे हैव द हिस्ट्री ऑफ एलर्जी और सम सॉर्ट ऑफ एलर्जी, डस्ट एलर्जी, wheat एलर्जी, और मे बी फूड एलर्जीज और सम अदर केमिकल एलर्जीज. ओके, सो राइनाइटिस या अस्थमा, कोई ना कोई एक हिस्ट्री मिलेगा. डेफिनेटली फाइंड वन ऑफ द हिस्ट्री in case of atopic dermatitis. Half of such infants will overcome this problem by 18 to 24 months. This is what exactly Kashyapa says. काश्यप क्या बताया कि चर्मदल का जो इंसिडेंट है, बच्चा थोड़ा बड़ा होने के बाद कम हो जाता है ना. सो उसके लिए उसने कारण बताया कि वो व्यायाम को सहन कर सकता है, वो बॉडी बहुत ज़्यादा एक्टिविटी करता है, उसका धातु का ग्रोथ होता है, इसलिए चर्मदल इज रिड्यूस्ड as the child crosses the age of क्षीरादा क्षीरानादा. उसके बाद जो है कुमारावस्था में कम हो जाता है. This is what exactly Kashyapa says. So here also they says that atopic dermatitis will going to decrease. Half of the patients, 50% of the patient will overcome this problem by themselves. as the age passes. ओके 50% विल हैव द प्रॉब्लम. अगर बहुत स्ट्रॉन्ग फैमिली हिस्ट्री है तो वो बच्चों में बाद में भी जो है वो चालू रहेगा. नाउ एटोपिक डर्मेटाइटिस में ऑल्सो अकर फर्स्ट टाइम इन द ओल्डर चिल्ड्रन. बड़ा बच्चों में भी एटोपिक डर्मेटाइटिस हो सकता है. ओके देन इट इज कॉल्ड एज क्रॉनिक. ओके इफ इट हैपन्स at adolescence age or later part of the life, then usually it runs a chronic course. Okay. Now what is the general management? General management in case of atopic dermatitis, parents education. Parents को समझाना चाहिए. This is because of allergy, most common cause. So you have to avoid the allergic substances. Number one, avoiding the contact with the irritants. क्योंकि एलर्जिक है और बहुत सारे जो सिंथेटिक क्लोथ होता है या एलर्जिक सब्सटेंस होता है उससे बच्चों को एलर्जी होगा. होते ही जो है ये लीजन बढ़ जाएगा. Therefore what you have to say, advise the parents to avoid the contact with the irritants like maybe synthetic cloth, maybe a strong soap, or maybe some other food material. Okay, maybe some of the outside food item like junk foods. Okay, or some of the vegetables. Okay, so this you have to advise. In atopic dermatitis dryness will be there, so always advise them to go for maintaining the moistness of the skin ka moistness you can maintain. Therefore always you go for yashtimatutela application of yashtimatutela. Quite good in Ayurveda. So in Ayurveda, treatment of Vata Jata Ramajala has to be followed in case of atopic dermatitis, nothing else. Exactly all the details are given in Kashyapa. How you have to treat. Different Kwatas are mentioned, different Parishekas are mentioned, and different medications are given, and treatment is also mentioned for the mother as she is feeding. And Ayurveda Kashyapa explains this Charmadala as a Dushtasannajanya Vyadi. Therefore, treatment should be also given to the mother, especially in infantile atopic dermatitis. Okay, these are the pictures you can see. In the cheek area most commonly affected, then it gradually spread all over the body. Another type of eczema, that is eczema form, that is contact dermatitis. Contact dermatitis, as the name suggests, this will spread by contact. When you come in contact with one particular irritant substance for a longer time, that leads to contact dermatitis. Okay, now what may be due to prolonged or repetitive contact with some of the irritants. For example, in the newborn, it may be saliva. बच्चे का saliva जो ड्रूलिंग होता रहता है तो उसकी वजह से उसको उसका जो कॉन्टैक्ट की वजह से ना तो वहां पे एक स्किन लीजन आ सकता है. मे बी स्ट्रॉन्ग सोप और कॉन्टैक्ट विद द शूज. ठीक है, कुछ शूज का है, कॉस्मेटिक और क्लोथिंग. अगेन दिस इज कॉल्ड एज कॉन्टैक्ट dermatitis. And once the contact is removed, the lesion going to disappear. Once the contact is removed, the lesion will going to disappear. One of the form of contact dermatitis seen in children is that is newborn is a diaper dermatitis. ठीक है, जो नैपकिन रैश है ये भी एक टाइप का कॉन्टैक्ट डर्मेटाइटिस है. क्योंकि आप नैपकिन लगा के रखेंगे, बच्चा वहीं पे स्टूल पास करेगा, यूरिन पास करेगा, दैट एसिडिक सब्सटेंस आर टचिंग द सॉफ्ट स्किन ऑफ द बेबी एंड दैट लीड्स टू द लीजन. So this is also a type of contact dermatitis. Diaper dermatitis is also a type of contact dermatitis, short-term contact. ठीक है, so usually diaper dermatitis को बाकी dermatitis से कैसे differentiate करेंगे? डाइपर यहाँ पे लगाएंगे, जो बटक का जो कॉन्वेक्स एरिया वहीं पे आएगा ना, वो जो folds है वहाँ पे नहीं आएगा. So usually in case of diaper dermatitis or contact dermatitis, only the convex portion of the buttock is get affected, not the folds. Folds are not get affected. Okay, so folds are not involved. So what is best you have to do is keep open that area, let the air move in and out, keep the area dry. Okay, and the contemporaries they go for so many zinc preparations and all that. We have a very good treatment. Again, the treatment is very simple. To make that area dry, one of the best thing is a Panchavalkala Kashaya for washing. Number one. Number two, those things which absorbs the water from that area and keep the area dry along with the anti-infective properties, okay, or soothing properties like spatika and tankana. Number two. Number three, some of the zinc preparations which is available in our science. For example, can go different anjana, rasanjana, application of rasanjana, and also rasakapasma. So these are rich in zinc preparation. So some zinc preparation should be given because zinc is important for the reproduction of the skin. Okay, epithelial tissues of the skin. Zinc and as well as vitamin E, both are very important. So this is what best treatment we can offer in Ayurveda for this. See, this is a picture of a contact dermatitis. Okay, so this is how it comes in the other body areas, and the diaper area we know that how it comes. The last one is seborrheic dermatitis. Okay, seborrheic dermatitis, this can occur at any age, but it's more common during the infancy and adolescence age. During the infancy and adolescence age, it is more common. Okay, so what is seborrheic dermatitis? Usually start from the scalp area, isn't it? Usually there will be cradle cap से जो है धीरे 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 जो बढ़ता बढ़ता ये आ जाता है. So dry scaly erythematous papular lesion, not popular, mistake it is, papular lesion, which is usually non-pruritic, not having much itching, may involve the face, neck, axilla and diaper area of the baby. Okay, so now scaling and crusting of the scalp will be there. Usually we will call it as cradle cap. Cradle cap, if it is mismanaged, then it may lead to seborrheic dermatitis. There is no hard and fast rule. Okay, cradle cap is usually self-limiting. Okay, you just apply any of the oil, olive oil or maybe Yeshtimadu Taila or Mahamarichadi Taila, any oil you apply, so it will be removed. Cradle cap will be removed. But sometimes it may be spread if it is super added with some of the infections or unhygienic conditions. Okay, not cleaning the head area. Okay, allowing the sweat to get collect there. So then it blocks the hair follicles. Okay, and there will not be no moisture. The moisture is not there. So that means it is not nourished properly, and because of the lack of the moisture, the area skin will become dry, and dry skin get the scaly, and this is how actually the pathology of this seborrheic dermatitis starts. And these are the pictures if you want to see. These are the pictures we can see. See, this is only happening in the head, and this is also in the head, and this is all over the body, including the diaper area. Including the diaper area, it is coming all over the body. Okay, so again, this can be very well managed in Ayurveda. Okay, best treatment is Mundana Samskara. Okay, Shirasa Mundanam Kuryam, Satatam Shirasam Mundanam Kuryam. This can be even compared with the Arumshika like conditions. Okay, Kashyapa beautifully explains the treatment of Arumshika, and treatment principle of Arumshika has to be followed in case of a seborrheic dermatitis like condition in children. So with this, we have completed the common most skin problem which we will see in the day-to-day practice of pediatrics. Thank you very much.